My name is Dr. Isaac Tawil, practicing dentist in Brooklyn, New York. Graduated from NYU Dental School, have a master's degree in biology from Long Island University. I attended NYU Dental School for 4 years, graduated, and was thrusted into a private practice setting. And I've been working in private practice dentistry for over 20 years. The main focus on digital dentistry and implantology. Currently in our office, we're utilizing the Shining 3D Aoralscan 3, the wireless version, which is really incredible. The 3D printers, the AccuFab L4D. We have the Wash as well, and the Cure, in addition to the MediSmile for the complete solution for the digital technology, along with the desktop scanner to provide those last little things that the intraoral scanner and extraoral scanners cannot provide for scanning models and for other structures that need to be digitized. The Aoralscan 3 wireless is truly an incredible product. One, it's very lightweight. It has interchangeable batteries which seem to never end, seem to last for an extremely long period of time. What's really exceptional about it is its one-touch design to just push button to scan. The other option is we can hold down the button and move through scans. So if we're taking the maxilla, moving on to the mandible, we don't have to ever touch our computer. Additionally, if we double tap this button, we can then begin to rotate the scanner, the wireless scanner itself, and view through the object itself by panning or zooming in and out. The other nice feature is the two different heads. We have a pediatric size head for those hard to reach areas or for children, and then a larger field of view tip as well. The heating element also is extremely quick, so we don't have to worry about fogging in the mouth. We can run through those scans quite easily. The wired version has all the same features as well, just with a wire. The wireless is truly exceptional because it's running on Wi-Fi 6. There really is no interruption with Wi-Fi or data. It does not necessarily need to be a point of connection or line of sight between the scanner and the actual base station, which is really exceptional because anyone who's worked with wireless scanners in the past knows if you don't have that wireless scan of sight, then often we'll lose scanning architecture. The other part that is really exceptional is in the software. The AI technology is revolutionary, being able to block out lips, being able to block out tongue without having to use any retractors. Additionally, tracking is really incredible. We can start in the scan and there can even be blood in the scan. If you're doing a full arch surgery and you want to capture those hard to reach areas that might have a little blood on it, this scanner scans blood really well without any difficulty. And if you went over to one side and came back to the other, the stitching features are absolutely outstanding, better than any other scanner I've ever used. Working with intraoral scanners for the last 10 years, running through a dozen different scanners in my practice, one of the hardest things to do is to train somebody how to scan. Whether it's trying to just have the simple ability to open the software and begin to scan, or scanning intraorally and having some difficult movements between the tongue and cheek. What's great about the Aoralscan 3, wired or wireless, is the scanner is completely intuitive. It's easy to scan, has a nice flow. The tracking allows you just to keep progressing throughout the scan without slowing down. And of course, AI technology to block out those hard areas, tongue, cheek, excess tissue that shouldn't be there. That scanner understands when to scan or not scan. So if you're first starting out with a scanner, you can pick up an Aoralscan and just get to work. There's nothing left behind. You don't have to go and take a full day course to learn how to scan. We just simply scan and the computer will take you the rest of the way. Having the Aoralscan now in my practice, my patients have absolutely loved it. They love being able to see the actual data on the screen in real time. They also appreciate the fact that the scanner doesn't bog down on them. Previous scanners, I've had some tracking issues, I've had some difficulty trying to capture scans on mucosal tissue, not keratinized tissue. The Aoralscan, we complete our scans in an extremely timely manner. The speed of the scanner is outstanding. My patients truly appreciate that.
It was unbelievable. I used to I've had a lot of work done in my mouth, and I've been doing scans, and I did the old, the plaster, and just this one just took so quickly versus the old way. We tried scans previously, and the old ones didn't work, but this one was so smooth and took a quarter of the time that it usually takes.
It was super easy, non-invasive at all. It took less than 30 seconds to get the scan done, and it was as easy as possible.
Because when we compare this to traditional impressions, of course it's going to be more comfortable to have an intraoral scan versus an impression scan. And an impression scan would typically take a few minutes. An intraoral scan shouldn't take a few minutes. We do have the ability to pull out of the mouth and come back in and give our patients a rest, which we don't have with impression scans. But if we have to sit there for 5 minutes to capture a full arch, that's extremely difficult on our patient, having them to try to open wide. With the Aoralscan, we can scan quickly, we can get a full arch in under a minute, routinely under 30 seconds, in difficult scans, probably about a minute, with a limited amount of frames, so we don't have to use an excessive amount of data to capture it. The field of view, 22 millimeters field of view, is really exceptional to capture all the data in the area, give us a large field of view, and if we need to reach those hard to reach areas, we can always switch over to the pediatric tip. So my patients have been extremely happy that I've been able to complete these scans quickly, efficiently, and they can go about their day instead of having to sit here for a lengthy period of time just to capture an intraoral scan.
Recently, I've wanted to get some orthodontic work done, and I've been shopping around at different offices, trying to see, the best price point and, to expedite the process as fast as I can, just so I can get my aligners done and quick and to start my orthodontic work as soon as I can. In the past, I've had work done using like physical molds and physical gunk that I really didn't enjoy. It was super nauseating. So here, using shiny 3D dental materials, we were able to get the physical impression done. Super easy, super fast, and I know I'm going to get my aligners done and I get them tomorrow.
So I used to, I did many impressions in my life, and I just remember putting the thing up in your mouth and then all the plaster coming out, and then after that you used to have the better flavored one, and then it was all sticky and you had to pull that out. This was just 2 minutes, zip, zip, and you got the whole thing.
I think we're on the cusp of a revolution. When I first started practicing digital dentistry, all the different componentry seemed way out of the realm due to affordability. The advances made in technology have enabled Shiny 3D to provide an affordable digital solution that rivals the best of the best products on the market. No longer do you have to be a high-end cosmetic dentist in New York or Beverly Hills to afford this technology. This technology is available to all. And in the coming years, as the technology continues to improve, we're going to be utilizing this in every aspect of dentistry. Meaning not only are we going to have our intraoral scanners, which will be getting better and more accurate, but we are also going to have the ability to finalize our restorations through 3D printing same day in just minutes. Gone is milling, hello printing, hello shining.